For the iCARE study, you have been selected to be in the PARTICS group. The selection was random. PARTICS stands for Patient-Activated Reliever-Triggered Inhaled Corticosteroids. This video will show you how to do PARTICS. We will teach you how to use an extra ICS inhaler, which we will call the PARTICS inhaler. You will use it every time you use your rescue inhaler or nebulizer for asthma symptoms like coughing, shortness of breath, chest tightness, or wheezing. By doing this, you will decrease the number of times you have asthma attacks and reduce asthma symptoms. Your usual rescue inhaler comes under many names, such as albuterol, ProAir, Ventolin, Combivent, Xopenex, or levalbuterol. You might also be using a nebulizer for rescue when you have asthma symptoms. You use the PARTICS inhaler every time you use your usual rescue medicines, whether with an inhaler or a nebulizer. You will use the PARTICS inhaler in addition to, not instead of, your rescue inhaler. Now we will teach you how to do PARTICS with your usual rescue inhaler and then with your nebulizer.
Every time you use your usual rescue inhaler for asthma symptoms, take a puff of the PARTICS inhaler for each puff of your rescue inhaler. This PARTICS inhaler is an inhaled corticosteroid which decreases the amount of inflammation in your lungs. That inflammation causes your lungs to be sensitive, makes you have asthma attacks, and causes asthma symptoms. Reducing inflammation reduces asthma attacks and decreases symptoms so you can breathe better over time. Using your PARTICS inhaler every time you use your rescue inhaler has been shown to decrease asthma attacks and improve symptoms. There are many different inhalers that we can prescribe that reduce inflammation, and depending on your insurance, you will be prescribed one of them. Some examples are fluticasone, formerly known as Flovent, Alvesco, Asmanex, Arnuity ellipta, Pulmicor, and Qvar. It is very helpful to keep your usual rescue inhaler and the PARTICS inhaler together so that you can use the PARTICS inhaler every time you need to use your rescue inhaler. To make it easier, you can use a rubber band to keep both together. If the shape of the inhaler makes it possible, you can nest them like this. And then you can rotate the inhalers like this when you need to take a puff. For example, if you have symptoms and feel you need to take your rescue inhaler, take the 1 or 2 puffs of your usual rescue inhaler as you feel you need. Then, take the same number of puffs of the PARTICS inhaler, just like we are showing here. If you can't nest your inhalers, you can still tie them together with a rubber band and use one after another. So if you take 1 puff of the rescue inhaler, then take 1 puff of the PARTICS inhaler. If you take 2 puffs of the rescue, then take 2 puffs of the PARTICS inhaler. As a reminder, each time you take a puff of any of these medicines, you want to take a nice, slow, deep breath in and hold it for 5 seconds, or as long as you can, to allow the medicine to get deep into your lungs. Then you can breathe out. You will get at least 2 PARTICS inhalers at a time if you use a nebulizer. You should put one of the PARTICS inhalers next to or on top of your nebulizer so you do not forget to use it. Each time you use your nebulizer for rescue, take 5 puffs of the PARTICS inhaler after you finish the nebulizer treatment. You may want to use a magic marker to write 5 on the PARTICS rescue inhaler that you keep near the nebulizer to remember to take 5 puffs after you have finished your nebulizer treatment. Inhale each puff and hold for 5 seconds. How does PARTICS work? Your usual rescue medicine, like albuterol, relaxes tight muscles around the airway, but it does not fix the inflammation in your lungs. So your symptoms may come back in a few hours. The PARTICS inhaler reduces this inflammation. Using the PARTICS inhaler every time you use your current rescue, whether that is the inhaler or nebulizer, will give you quick relief and help the inflammation that often keeps symptoms going. Using the Rescue and PARTICS inhalers together can give you better control of your asthma and help reduce asthma attacks. This may also mean you need fewer doctor visits, emergency room visits, and less steroid pills. What should you do with the other inhalers that you have been prescribed and are using? You need to continue to use all other usual asthma inhalers and medicines as you have been. The PARTICS inhaler is in addition to, not instead of, your regular asthma medicines and your rescue inhaler or nebulizer. Our study doctors will prescribe the PARTICS inhalers for you. Depending on your insurance and the phase of the study, we will write you a 1-month or 3-month prescription. The study coordinator has reviewed the reimbursement with you. You and your insurance will continue to pay for the daily maintenance inhalers and any other medicines you usually use for your asthma. After you have picked up your PARTICS inhaler, we will provide you with a packet of additional study information.
How does the study keep track of how you're doing? Each month, you will receive a short set of questions to answer. The questions can be answered on your smartphone or computer, or you can be called to complete the questions each month. Please let us know which way is better for you. Because the questions are very important to the study, each month we will send you reminders to answer the questions and pay you $20 for each of the surveys you complete. So let's review. Each time you use your rescue inhaler or nebulizer, also use the PARTICS inhaler. When you use a rescue inhaler for symptoms, take your PARTICS rescue inhaler puff for puff. When you use a nebulizer for rescue, take 5 puffs of the PARTICS inhaler after you finish your nebulizer treatment. Note that the PARTICS rescue inhaler is in addition to, not instead of, your usual rescue and other asthma medicines. Continue your other asthma medicines as you have been taking them. If you have problems with your asthma during the study, like having to go to the emergency room or hospital, or having a worsening of your asthma, we may call you to ask some extra questions. As a safety point, remember, if you've had to use your quick relief medicines hourly or more frequently for 2 to 3 hours in a row, or if at any point you are unable to speak in full sentences, unable to lie down flat, or having lots of trouble breathing, seek medical help immediately or call 911. Remember, the additional PARTICS inhaler is not a substitute for your quick reliever. Thank you for watching this video to learn how to do PARTICS and for being in our study. A study coordinator will now ask you to review what you have learned and answer any questions you may have.